The Spect scan is used to assess the function of tissues or organs in your body to identify the disease. A CT scan provides your doctor a high-resolution images of structures of your body. In other words, Spect assesses physiology and CT assesses anatomy. Today, generally a Spect scan is performed with images from two different types of scan captured during one session using a hybrid scanner, and the images are combined. Each piece of information is important, but when combined, it is even more useful. The Spect scan is undertaken in two parts: the administration of tracer and then the scan that shows how the tracer behaves in your body. A nuclear medicine is generally administered to an intravenous injection that can also be inhaled, swallowed, or injected in the skin. What study you have will decide how the tracer is administered and whether it is done lying down on the scanner or elsewhere in the chair. The injected nuclear medicine gets taken up and concentrates in the part of the body in the investigation. Some diseases cause increased function, some decreased function, and some cause changes in function, all of which can be imaged on the scanner. Virtually, all tissues and organs can be investigated using a nuclear medicine. The most common procedure includes bone to detect and assess changes in bone function associated with cancer, trauma, metabolic changes, and many other diseases. The function of the heart can also be evaluated by examining the blood moving through the heart or imaging the blood flow and movement of the heart muscle itself to diagnose a variety of diseases. Nuclear medicine can also be used to study lungs, kidneys, thyroid, brain, and many other organs and tissues in the body, and more importantly, to investigate cancer. Because some body functions are fast and some are slower, the time between the administration of the tracer and the scan can vary from minutes or hours. Some people are even required to come back on multiple days. For diagnostic scans, the nuclear medicine is radioactive and emits gamma rays that can be detected by the scanner. The Spect CT machine has two gamma cameras that detect gamma rays and produces a map how the tracer is behaving. These detectors rotate around the body, taking images every few degrees, allowing images to be reconstructed in 3 dimensions. What to expect during a Spect scan? First, radioactive tracer inserted through IV. Second, tracer circulates through body. Third, lie on table while gamma camera rotates around body. Lastly, camera creates 3D images of organs and tissues. For those who are curious, this is how Spect works. The collimated gamma rays hit the crystal detector, usually sodium iodide crystal, doped with thallium, which converts the energy of the gamma rays to visible light. As the visible light travels through the photomultiplier tube or PMT, they absorb the light and emit electrons. The electrons emitted are used for image formation. They are detected by positioning and summing circuit which decode the body position of the original photon. A pulse height analyzer or PHA decodes the energy of the emitted photon. And then, the information is passed on a digital circuit on a computer where algorithms are used to reconstruct the image. The resultant image gives a physiological state of the organ. Hotspots or areas of increased uptake, called dark spots or photopenia, or areas of a decreased intake, may indicate pathology such as arthritis, infections, tumors, and fractures. Here are its parts: gamma camera, patient bed or table, rotating detector head, display monitor, and interface. Radioisotopes typically used in Spect to label tracers: iodine 123, technetium 99, xenon 133, thallium 201, and fluorine 18. These radioactive forms of natural elements will pass through your body and be detected by the scanner. More than 85% of radiopharmaceutical being used to diagnose cancer and infection are technetium 99 labeled.
Radiation Safety Guidelines. ALARA Policy. The goal of the Radiation Safety Program is to ensure that radiation dose to workers, members of the public, and to the environment is as low as reasonably achievable, or also known as ALARA, below the limits established by regulatory agencies. talking about the radiation safety of the patient during a Spect scan, every practice involving ionizing radiation should be justified in terms of net positive benefit. There are various ways to ensure radiation protection of patients during a Spect scan. First, there should be an optimized imaging protocols. Implementing imaging protocols that uses the minimum necessary radiation dose while maintaining diagnostic quality should be followed. The facility should also utilize gating techniques to synchronize image acquisition with specific phases of physiological processes, reducing the overall exposure time. There should also be a careful selection and optimization of radiopharmaceuticals to minimize the administered dose while achieving the necessary diagnostic information. When it comes to shielding, lead aprons and thyroid shield must be provided. Provide patients with lead aprons to shield sensitive organs and thyroid shields to protect the thyroid from unnecessary radiation exposure. Collimator must be taken into consideration as well. Implementing collimators in the imaging equipment will enable focusing of the radiation beam and reduction of scatter radiation, improving image quality while limiting exposure to surrounding tissues. Ensuring that patients are well informed and with consent about the procedure, associated risk, and the necessity of the radiation exposures, also practice of radiation protection. Properly positioning and immobilizing the patient during the scan will also minimize the need for repeat imaging and reduce overall exposure time. Pregnancy screening is a necessary procedure as well. Implementing stringent pregnancy screening procedures will avoid unnecessary radiation exposure to the developing fetus. The nuclear medicine facility should be well planned with sufficient number of rooms for intended operations, including the storage and disposal of radioactive waste, as approved by the component authority. All the equipment required for sail handling should be available in each room for proposed operation. The staff should be adequate and well trained in handling radioactive material. Radiation monitoring instruments such as survey meters, contamination monitors, pocket dosimeters, digital monitors, and etc. and decontamination facility should be readily available. Personal safety measures involve the proper use of PPE, continuous monitoring of radiation exposure, and the implementing protocols to limit the time of exposure. Additionally, comprehensive training programs ensure that healthcare professionals are well versed in radiation safety principles, equipment operation, and effective communication during Spect procedures. Regular continuing education further enhances the knowledge and skills of the staff, contributing to a safe working environment in the field of nuclear medicine. To summarize, good work practice is an essential component of radiation safety. This includes observation of all radiation protection rules as applicable to nuclear medicine, use of appropriate safety devices, remote handling of tools accessories, and maintaining good housekeeping habits in the laboratory. In addition to the external irradiation, there is a chance of radioactive contamination while handling unsealed sources in nuclear medicine procedures. The radioactive waste generated during preparation, dispensing, and administration of radiopharmaceuticals shall be handled carefully to minimize exposure to staff, the public, and the public.